Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Health Flow Podcast. This is episode number 15, and I'm so pleased to have Chinedum Clark. That's Dr. Chinedum Clark. She's a good friend of mine. We've worked side by side in the ER in Georgia. So Dr. Clark has agreed to be my guest today. Our topic is going to be on strokes. Dr. Clark is a graduate of the University of Missouri Medical School. She attended residency in Columbia University, and she did her emergency board certification at Emory University back in 2012. She's also happily married with 2 children, ages 3 and 11 months. And one of her passions, working out and spending time with her family. Welcome, Dr. Clark, or
thank you,
known as the beloved Chi Chi. Welcome to the Health Flow Podcast.
Glad to be here. Thank you.
Thank you so much for joining me. Today, we're going to just get right in it and talk about strokes. This is a common occurrence, unfortunately. So just go ahead and just tell us your definition of stroke.
So just to keep it simple, a stroke happens when there is a lack of blood supply and therefore a lack of oxygen to a part of the brain. And this can happen a couple of ways. So you can have a clot that obstructs the blood flow to a part of the brain, what we call an ischemic stroke, or you can actually have rupture of the blood vessel that's supplying a certain part of the brain, and that results in a hemorrhagic stroke. In the U.S., most of the strokes, that we see are ischemic. About 85% are the strokes due to clots in the blood vessel.
Okay. And what are some of the symptoms of a stroke?
So sudden onset of facial droop. So you'll see the face twisting, arm, leg weakness and or numbness, slurred speech or inability to speak, what we call aphasia, vertigo, which is that round and round type of dizziness, and clumsiness in gait or movement. And that's just some of the things that you'll notice in a stroke.
Right. And if a person develops symptoms of a stroke, what should they do immediately?
So call 911. Call 911 because time is tissue. The quicker you're seen and evaluated, the more likely you are able to reverse those symptoms if you present in a timely fashion. Kind of an easy way to remember the symptoms and what to do next is this mnemonic called FAST. You probably have seen the posters up in various hospitals. F stands for face droop, A, arm weakness, S, speech slurred. And if any of those symptoms are present, then T, time to call 911. So just something to keep in the back of your mind.
That's excellent. Can you say that one more time for our audience?
Yes. So the mnemonic is FAST, F-A-S-T. The first 3 letters represent some common symptoms. And if they're present, you call 911. So F, facial droop. That's the twisting of the mouth. A, arm weakness. So you just have your family member hold their arm up. And if it starts to drift, one of the arms starts to drift, then that would signify that arm is weak. Or if there's any slurred speech, then T, it's time to call 911.
Gotcha. And I'll be sure to have those in our show notes. So FAST is the mnemonic. Oh, I can't even say that. How do
I
you say
can't. I can say it, but I can't spell it.
it? Well, I don't need to know how to spell it, but I mess that up all the time. So, what are some of the causes of strokes, or I should say, the predispositions? Like, what are some of the things that will put a person at a higher risk for having a stroke?
So very similar to risk factors for heart disease. High blood pressure. High blood pressure is actually the leading cause of stroke.
Uh-huh.
Smoking, diabetes, obesity, and then family history. That's one risk factor, excuse me, that you can't do anything about. But the four previous are things that can be controlled.
Right. Keeping your blood pressure under control,
Yes.
definitely. And even like you said, cholesterol levels, because anything that can, if it can clot in your heart, it can clot in your brain, right? It can clot
Exactly.
that. And
Exactly.
yeah, those are all important. And then smoking. Could you explain a little bit further why smoking, what is the effect that smoking has on our vessels that can cause them to, you know, to become a stroke? How does it affect your blood vessels?
Yeah, so smoking over time, there's a lot of processes that can happen, but kind of the gist of it is it creates an inflammatory process, one that leads to atherosclerosis, which is the hardening of the vessel,
Right.
and causes you to develop plaque. So that causes the blood vessels to either be narrow, so that decreases the volume of blood they can carry to a particular area, or the plaque can rupture and cause a clot and block the blood flow, to that particular area. So smoking is bad.
All around it's bad, and
All around.
it does seem, well, I guess it depends on which part of the world, which part of the United States you live in. I've had with traveling over the last 6 months and working, and I'm now on the West Coast, and I'm actually surprised to see that. To me, this is only my perception. My perception is that there are more people smoking cigarettes on the West Coast than the East Coast. That's just
Really?
yeah, that's my perception. I was really surprised to see that. Even healthcare workers,
Huh.
um, nurses. I mean, I used to think that, for a while there, that went out of vogue. Like people took that serious. But yeah, there's
Well, on
places.
the West Coast, they're all body conscious and health conscious, so that's kind of
Yeah. I
shocking.
mean, it
Not
may
trying to make any generalizations for
we're not
anybody who's
general exactly. It's the
from the West
areas
Coast.
that I've been. It's not like it's LA or San Francisco per se, but just in some of these smaller towns that are on the West Coast. Yeah, I mean, even in Arizona, I mean, there was a lot of people that really opened my eyes to seeing so many people smoking. But I mean, no judgment or generalization. We just want you to be healthy, and smoking has not all of a sudden become something healthy. It wasn't good back
Right.
then, and it's still no good now. So wherever
Still
you
not good.
are, smoking is just not good for you. So what are some of the different types of strokes? I know you said ischemic strokes, but you can also have traumatic strokes, can you not?
Yeah, so I mean, the trauma can lead to something like a hemorrhage.
Right.
So, the end result is still the same. So I think just for the purpose of simplicity, it's easier to think about it as, a clot versus a hemorrhage. So that kind of keeps things simple, because there's a lot of things about strokes that can be confusing.
Right. So a clot meaning a blood clot
A
sitting
blood
inside of
clot.
a vessel
Yeah,
versus hemorrhage meaning you're bleeding from that particular vessel, and the bleeding is spreading out into your brain.
exactly.
Okay.
Which makes a difference in how you manage them, because you don't treat them the same.
All right. So let's talk about, a clot versus hemorrhage. What is the treatment? How can we break those down?
Okay, so with the blood clot or the ischemic strokes, the main thing is determining whether or not a patient is a candidate for receiving the therapy, and the therapy is a clot busting drug, what we call alteplase or TPA.
Mhm.
There are very specific criteria for getting the medication because there can be some side effects. So you want to make sure that it's appropriate for the patient to receive it. And one of the big things being that symptoms have been present for 4.5 hours or less. And it has to be a known exact time. And if there's any question about the time of onset, then TPA is probably not a good medication to administer because you just run the risk of complications past that time point. If you determine that a patient is not a good candidate for TPA, which is the clot busting medication,
Mhm.
the next step is determining whether or not they're a candidate for clot removal or thrombectomy. And
Mhm.
that's usually done at a stroke center within 24 hours of symptom onset or last known well, which is the last time somebody saw the patient well.
Okay.
Um, versus a hemorrhagic stroke. So that's a bleeding stroke. So you're not going to give a medicine that would make them bleed more. The
Right.
main thing is lowering the blood pressure to, keep the blood vessels from dumping out, all that blood. So the goal is to get your systolic blood pressure, which is that top number, to around 140. And then obviously getting neurosurgery involved because most of these cases need some sort of surgical intervention.
Right. Um, okay, so I'm just going to go over this again. Like Dr. Clark said, there's other reasons too why patients cannot receive TPA. Besides the 4 hours, there's things like recent surgeries.
Mm-hmm.
Um, that's one. And I think your general health condition or any previous bleeding disorders that would make you not a good candidate to receive it. So we talked about time being of essence. That 4 hours from the time a person develops symptoms, if you're with someone and they have stroke-like symptoms, if someone could have the presence of mind just to remember the time so that,
Yes.
you're helping this, we're giving this information so that you can be more informed and be more helpful to when you get to the hospital, this goes a long way so that there's no guesswork. um, their history, not just family history, but their surgical history. What medicines are they on? Are they allergic? Back to basic things that we've spoken about. It's very important, and families and friends are very crucial in helping the healthcare team give the very best care. The more
Right.
information that you come in with, the better we can assist you. So you need to know what time the stroke-like symptoms started. You need to know their history, have their medications written down, and just be there with all this information. I mean, this would mean a lot, wouldn't it? Don't you say?
Yeah, yes. And just to hammer home, the time thing is so, so important. I can't even tell you how many cases that I've seen personally where TPA was denied or not recommended by the neurologist because there was such confusion about the time of onset. And
Yes.
it's unfortunate because some of those cases you're like in every other way the patient was a candidate for TPA, but it was just because they couldn't pinpoint the time, kind of disqualify them. So
Right.
time's important.
And that really is painful or hurtful to the medical team because, when you come into the hospital, we want to give you the best possible care. But if
Right.
we're not able to, there's guidelines, and we have to practice within those guidelines. And we depend on the family members and friends who are with victims, patients, to have that information to help us make the very best decision. So I just don't want to downplay how important bystanders, friends, family, they're very important in marking the time so that you can get the best possible care. These things, yeah, they come with risk, but we also know the benefits, and you could probably do a whole lot. I mean, it's a big, how would you say, like the outcome versus someone who could have benefited from TPA and then someone who could not get it, you know, that could be a really big difference in
Oh
your
yeah.
final outcome, right?
Yes. I mean, I've seen people come in with what would otherwise be debilitating, you know, weakness, be completely reversed after TPA.
Yeah.
And, you know, it's just unfortunate for somebody to not get a medicine as life saving as TPA, just simply due to not knowing the exact time of onset.
Right. Right. Yes, that's important. I mean, because if you can just imagine, I just want you guys to get the picture of when we talk about someone who come in, say, with complete right-sided weakness from a stroke that they have on the left side of their brain. And you know that if that clot is um, not so much the clot, but even if it's a clot being removed, or if they can get the TPA, um, or the bleeding can stop. You know that if these things are done, it's possible that person's left-sided weakness will completely be gone. That's what we're trying to say. This is how important this is. Some things
Right.
can be stopped. Yes, sometimes we can't, but some of it can. So it is important to do these things. So what are some of the things that we can do to even prevent strokes before we even get to the point where a person has a stroke?
Right. So it ties back to kind of what we discussed before as the risk factors, essentially,
Right.
you know, addressing your risk factors. And you can't do anything about your family history. You're stuck with the family that that God gave you. But if you
Right.
have high blood pressure, get on meds, you know, if that's what's necessary, lose weight to control your blood pressure, exercise, that kind of thing. Stop smoking. You know, I'm not a smoker, but I assume, you know, that's hard to do. But if it's stroke
Worth it.
versus, you know, it's worth it.
Mm.
Um, Controlling your blood sugar if you're diabetic, watching your diet. So diets high in fat are going to raise your cholesterol, and you know your high salt and sodium diets are going to make your blood pressure high, and your high calorie diets are going to make you gain weight. So you know we everything in moderation. You know everybody loves desserts and things like that. I'm not saying you can't have that, but you know on most days you really should be watching what you're putting into your body if strokes are something that are going to be a risk for you.
Absolutely. And I can't even especially for African Americans and African American males, I just want to take this time to stress the importance of keeping your blood pressure under control. It is not something that you can just ignore. It's called a silent killer for a very good reason. You don't necessarily have symptoms. And sometimes by the time you start having symptoms from your high blood pressure, you've already damaged something. You're about to have a stroke, you can have a heart attack, or you can damage your kidneys. So please take it serious, do something about it. What do you
I
have to say
second
about
that.
that?
I second that. I mean, just being in the South, I've seen a lot a lot younger than you would expect. A lot of just medical care in general in the African American community has a lot to do with our fear of doctors. I mean, we could do a whole other podcast about this and how it affects, you know, our health in general. But, you know, men are, you know, less likely to go to the doctor, but African American men are even, you know, more or less likely to present. And so that, you know, results in men walking around with untreated illnesses, you know, and one of those being hypertension, which can essentially put you at risk for really bad things like strokes. So
Right.
it's just really, really important to get yourself taken care of.
And I just want to add to that, it's not necessarily, I'm not sure, I know research may say otherwise, but it's, to me, it's not necessarily that we tend to have a higher rate of incidence. Sometimes I think it's because our outcomes are much worse because we don't have the annual checkups. We're not complying with taking medications. So, or we just don't get checkup on health situation, so that when you do present yourself to the healthcare provider, you're either already like way down the line of, it's already affected. They call it doing end organ damage. That's already been done. So it just
Mm-hmm.
seems like that in its sense is how a lot of African Americans are afraid of going to the doctors, because they have this fallacy of saying, but if I go, I'm only going to get bad news, or they're going to diagnose this. But you not going, you ignoring your symptoms, that doesn't help. It means that when you do go, you've waited so long that your disease progression is probably going to be worse.
Right.
All right. So, is there any other information you'd like to share about strokes?
Well, I just wanted to share that there is a very useful website, www.stroke.org. That is the official website of the American Stroke Association. There is tons of information on there, especially for people who are, not medical. It's very simple to understand, and there's even a stroke risk quiz that you can do to, assess what your risk for stroke is. So I think all of that is helpful.
And I'll make sure that I put that in the show notes. That's www.stroke.org. And it might be
Yes.
a good idea for people to get on and put the quiz. If there's any way I can put the quiz in my show notes, I will. And so this is just a bonus. Anything else you want to share about strokes?
No, that's it.
All right. So this is
I think that's a good start.
okay, exactly. This is just a start, because it does get complicated. There's a lot of factors that if you do have a major stroke, and just what it does to families if you're not able to recover fully, go back to your previous lifestyle. So we can have many, many updates to this. But so just a bonus section for my Health Flow podcast listeners. So you're a mom of two, a 3-year-old and an 11-month-old. And I was admiring you and complimenting you about how wonderful you look, and like, what did you do to snap back so quickly? Share, girl, share. Tell us.
Well, I don't look at it as a snapback. I think this pregnancy, the second one, I was more fit going into it than I was with the first. So that was just a huge factor. I didn't gain as much weight, so I didn't have as much to lose, and I was stronger, faster postpartum, which enabled me to, work out earlier and actually kind of be more intense with my workouts. But you know, I just kind of want to convey to the women out there that, when you have a baby, the actual process of birth is so traumatic on your body. So, I feel like a lot of our focus is on the wrong thing. We really shouldn't be focusing on trying to lose weight. We really should be trying to, heal our bodies,
Healthy.
get
Right.
our minds right, because you're taking care of another human being. And so that's the time that you use and need to bond with your child. And then as you start to heal, you can slowly move into working out and that kind of thing. So
Right.
yeah, it wasn't until later, I was focused those first few months on, bonding with my daughter, breastfeeding, healing. And then once I felt up to the challenge of, working out and trying to lose the weight, then I started.
But what I heard you really say that was really important is that you went in it healthy. You were stronger. You
Yes.
were more in shape. So, I mean, it's not like you had to take a step too far back. You know what I mean?
Right. It and everything they say about exercising during pregnancy is true. My OB told me that, if I worked out during my pregnancy, which I did with my first one, but the second one, like I said, I was more fit going into it and I worked out I think up until it was like 32 or 33 weeks, but it actually helped with the labor and delivery. It was a lot quicker than the first one. Um, so I think that that has a lot to do with it too. So just being healthy going into it, you're more healthy coming out of it. You don't have as much, to make up for.
32 weeks.
So for me, I did light weights. I mean, I just couldn't do a whole lot. I had a lot of, well, not a lot. I had enough back pain where I just couldn't be super vigorous. So I tried to do exercises that didn't require a lot of weight bearing. So the elliptical, walked on the treadmill. I did light hand weights, just things to
Yeah.
get my heart rate up. And then
Right.
when I was too short of breath to do it, I stopped.
You weren't overstrict, just overexerting yourself. So
No,
that's
I went to my limit and I knew what my limit was. I have a heart rate monitor too. So I kind of would keep track in real time of where my heart rate was. And I just didn't push myself too hard enough to, you know, get the blood flowing, but I wasn't doing what I was doing pre-pregnancy. Definitely not.
right. And now everybody talks about work-life balance. So I want to add work-life family balance. How do you
Yeah.
do it? Any suggestions that you have? Any tips for?
Honestly, my help I get my husband. I mean, I'm not even going to sit here and act like I do this all by myself. Without him, I would be so lost. So I just want to shout out to the single mothers who do it by themselves because, with the husband, I feel overwhelmed sometimes. So he helps me a ton. And then, I think it's important whether you're a mother of one or mother of 10, whether you're single or married, is you have to take time for yourself.
Right.
Whether it's 5 minutes or 50. And, for me, my guaranteed time is that hour before I leave the house to go to work.
Mm.
I'm working out to clear my mind, I'm listening to music, getting ready to go. But that's my time, so I'm at least guaranteed that time weekly, you
Mm-hmm.
know. So you just have to kind of block, your calendar off, your schedule off for yourself because
Yeah.
if you don't take care of yourself, you can't take care of anybody else.
That is so true. I said those very words to a lady that came in to see me at work today, and she she's 40 years old, so she had a child at an older age. She has history of bipolar and depression, which I didn't know prior to going into the room because she had like saying she was tired, having like cold-like symptoms and an earache. So when I went in to talk to her, I was like, well, what's going on? And she started, clearly, she was depressed. And her thing, like, look how we put so much pressure on ourselves.
Yeah.
Her baby is 1 year old. She is still breastfeeding the 1 year old child. And because of that, she has not resumed any of her bipolar medications
Oh, wow.
because she wants to continue nursing. And I said to her, I said, at what point are you going to take care of you? Like, do you understand that if you're mentally well, you are going to love and take care and nurture your child better?
Mm-hmm.
Just taking time for that. And sometimes it's just somebody pointing out to them to say, hey, you did a great job already. You did a whole year of breastfeeding. That's
Right.
awesome. Girl, stop. Take the pressure off. Do you now
Yes,
so you can be a
exactly.
better mother. So that's my advice to everyone, all the women out there, is that it is balance. You have to balance giving, you have to balance receiving, and receiving is you receiving that time for you to help, to take care of you so you can be a better you.
And doing it guilt free. That's another thing, because time to yourself that you're spending. Oh, I should be doing this. I should be doing that. That's not worth anything. You have to take time for yourself and feel like you deserve that time for
Absolutely.
yourself.
Absolutely. Well, this was wonderful. Chi Chi, thank you so much. We have to do this again so we can just keep on giving.
I was
So,
just gonna say, I this is my first time doing a podcast, but I don't think it'll be my last. So yeah, call me anytime.
oh, well,
I'd be more than happy to do it again for you.
okay, we're going to do this again. So thank you so much and just continued blessings to you and your family.
You too. Thank you.
All right. Bye-bye.
Bye bye.
Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.